All right, dear students, you are welcome to this session. We shall be looking at nursing process. By name called Kiden Robina, and I will be taking you through this session, guiding nursing actions for holistic patient care centered. Like previously we said, that you may have 2 to 3 people suffering from malaria, but they will respond differently. Their bodies will respond differently to the infection. Others will have diarrhea, others severe headache, others will have abdominal pain. So the nursing care that we give to these patients is determined by how their bodies have responded to the infection. And that's why we call it a patient-centered care. So the importance, it involves scientific reasoning and critical thinking for optional uh, client care. So when using nursing process, you need to always reason and think critically. You should be able to identify the problem, then get a solution to that specific problem. Like you're nursing someone, uh, if you have been giving the patient medication, you should know that there are some medications that have side effects. So as a nurse, if you are nursing someone and the person has a severe side effects, there are chances that you may need to withhold the treatment and inform the doctor immediately. So such critical thinking is very, very important to us. It's not a matter of doing what the doctor has instructed us to do. Like for instance, administering medication, and you only concentrate on doing that. So it involves thinking outside the box. So purpose of the nursing process, the purpose is to identify clients' health status and needs, that is assessment, establish plans to meet identified needs, deliver nursing interventions, that is through diagnosis, planning, and implementation, then apply evidence-based care for health and illness, legal protection for nurses adhering to standards. If you do your nursing care up to the standard, in case they sue you to court, you can use the documents that you have, the documentation that you have used, the nursing care plan that you have used. It can be able to bail you out. For instance, if they charge you of patient negligence, but you were able to document each and everything that you did to the patient, and there was a third party who observed when you were doing these procedures, then you will be able to be free because you have actually followed the right procedures. Then systematic practice organization. So the care that we give when we use the nursing process is systematic, following a certain kind of order. Then create a client a health database that we can be able to refer to in case we need more information about the care that we are giving to the patient. So still continuing, Samuel, my so the first characteristic is the nursing process is patient-centered. It uses patient-centered approach. It is respectful, responsive care tailored to patient's needs. What the patient needs is what we act on. We don't say that these patients are all suffering from malaria, so we give the same kind of care. No, because their bodies respond differently. So that's why it is patient centered. The patient, the character, the features that you have observed on the patient determine how you are going to care for him or her. Then a nurse also acts as the advocate in this case for informed decision making. This means that you educate the patient on what is right and what is wrong. Then the patient can also decide on what he thinks is the right thing to be done. Then we also talk on behalf of the patient as far as nursing process is concerned, more so concerning the care given to the patient. Then interpersonal interaction, therapeutic nurse-patient relationship. So we have that in nurse-patient relationship, which is purposive, and it is targeting the care that we give to the patient. Other than that, there is no any other. We don't develop this casual kind of relationship, but what we do and the interaction should be for both. So during the nursing process, we also have that future of learning and growth. We learn from the patient, and the patient also learns from us. Then collaborative teamwork, nursing and interprofessional collaboration, shared communication and decision making. So we don't do all the care that we give to the patient cannot be done by the nurse who is on duty alone. So it is a shared responsibility. We collaborate with the other disciplines, like for instance, physiotherapy, dietitians, and many others, because we need to consult from them. As a continuation, dynamic and cyclical nature. So phases interact and influence each other. You cannot go to the second phase when you have not finished the first. You cannot diagnose when you have not assessed the patient. So the first step comes first, then the second also follows like that. Then it is cyclical. It is dynamic and cyclical in such a way that with time you need to go back to the first step, then again follow all the phases like that. Critical thinking requirements. So this nursing process requires critical thinking in everything that we do. Like I mentioned before, you should be able to identify the problem and get the right solution to it. Nursing process steps, there are 5 steps. That is assessment, diagnosis, planning, implementation, and evaluation. So these you can abbreviate them in the mnemonic of ADPIE. So iterative process, the nursing process has phases that overlap and continue. Hmm? I beg your pardon? Hello? So the first phase, which is assessment, has involves collection, organization, validation, documentation of clients' health status, and under these physical examination and observation, which we shall look into details. So right there's a pictorial that is showing a nurse interacting with a client the nurse is trying to assess the client. Types of data. We have objective data. The objective data is basically the measurable and tangible information. So this normally we get it through the assessment as the health workers. When you take the vital signs of the patient, do physical measurements, then observations, you're able to obtain this data. Then subjective data. This is a kind of data that you will get from the patient. These are inner thoughts that the patient herself tells us. If we don't hear from the patient, if the patient does not tell us, we cannot know what exactly is happening. Then we have verbal and non-verbal data. So the verbal data is the spoken or the written information. Then under it also we have statements, tone, and assertiveness. The statement that the patient makes, the tone through which the patient makes these statements. For instance, you ask the patient, "How are you feeling today?" Then the patient tells you, "I'm feeling okay," but you feel that the tone that the patient is using does not actually mean what she is saying. So those are some of the observations that a nurse can make. Then assertiveness, the strength through which, or the confidence through which the patient says something determines whether it is really realistic or not. Then in non-verbal data, uh, this one is observable behaviors without words, body language, gestures, and the facial expressions. So this we see how the patient is behaving. The patient tells you that she's okay, she's not having any pain, but you see she's frowning her face. So that facial expression shows a lot of things. Then sources of data, we have primary data. This one we can get directly from the client. Then we have secondary sources, which are the family, supportive persons, reports, and the health professionals. Then we have tertiary sources. These include external sources like textbooks, journals, and the surveys. So these are more so when we read from the internet, they contribute much to our knowledge. Then we still continue with methods of data collection. So we have health interview. So in the interview, um, the health interview is a purposeful communication, and it involves taking the nursing health history, creating rapport is actually the major foundation of the assessment phase. So you make an appointment with the patient that I'm coming to interview you. So she will also be ready, and as you interact with the patient, you can be able to get information from her. So right there in that picture, you can see that a nurse is having her pen and a file ready to note down anything that the patient tells her. We continue with the collection of data. So besides interviews, nurses conduct physical examinations. We examine the patient from head to toe, and that is our responsibility. Though the doctors do so, but also us, we also do examine. And there are some things that we shall be able to find out. Then referring to health history and the family history. So you can refer to the health history of the person and the family history. This can show you a lot about the patient. Then observing the patient aids in gathering assessment data. So you observe around and see the eyes of a nurse should always be sharp. There are other things that you will identify from the environment. There was a patient who was admitted with the diabetes. So the junior doctors did not identify exactly what is wrong with this patient. But this patient was having water by his side, and all the time taking water. So when the senior doctor came, when they were interacting with the patient, the senior nurse asked the doctor that, "But doctor, have you people thought of checking for diabetes? Because what we have seen is this patient is always taking a lot of water, and the jar of water is always by his side, taking a lot of water, and also our urine output is much." So that opened people's eyes. And indeed, when they did the glucose test, it showed that the person was having diabetes. So as nurses, there are things that we can observe also. Then we can help the doctors make decisions. Then establishing Accurate assessment leads to better diagnosis, planning, and interventions. Utilizing observation in assessment. So patient observation is reliant on the five senses. Provides information about appearance, function, relationships, and environment. So the senses that we use in the observation of a patient include the sight, touch, hearing, smell, and the taste. So we use all these senses. When we are around, we make sure that we observe in every corner of the patient. We observe the patient himself. Then also we can also touch the patient during examination to feel for the temperature and other things. Then hearing, we hear the way the patient is talking, the way the patient is breathing, and many other things. Then smell, this is the most important. Smell around the environment, this will tell you a lot. Yeah. So with the testing, this normally is not so much encouraged because there are many things that come with the testing may end up bringing infections, but where necessary, it can be used. So, for instance, like if you can use this to find out about actually the patient's test, you yourself, you may test a certain food and feel the taste, but if you give the patient to eat that very food, then the patient will not be able to tell the taste. Then that means there is something wrong with the patient in that specific area. Then vital in making accurate assessments. So all these ones are very, very important to make sure that we make vital assessments. When we put all of them together, validating data. Validation process verifies the and this involves double checking before you come to conclusion that this that you have done is the right thing. You need to double check it. For instance, taking blood pressure and it is high, it means the person may be having high blood pressure, but you are not sure. This is not conclusive. So what you will do is you can take it again. Then you see if you take it like 3 times after the patient has rested, then again after the patient rests again and it still shows the same, then you have the right to involve the doctor in that. Then yes. So a comprehensive assessment, this is like a detailed assessment. So validation of the data in such cases is very, very important. It requires avoiding conclusions without substantial data support. So key aspects of ensuring data accuracy. One is double checking. This I've already talked about it. Validating subjective and the objective data. Then avoiding premature conclusions. You don't jump into conclusion before you verify. Then clarifying ambiguous statements. Statements that give you double meaning. It can mean A, it can mean B. So you need to first single meaning and it should be clear. Gathering overlooked details. There are some details that some people don't pay attention to. So you need to go into details of all that in there. Then distinguishing cues from inferences. So cues, these ones are like statements that are not confirmed to be true. Then inferences, this already you have evidence that shows that what is being done is true or what is being said is true. So you can refer to that. Documenting accurate data. Accurate recording is fundamental. So when recording data, make sure you record the right information that has been given to you. Then involves correct data collection and documentation. Should be accessible to the entire healthcare team is crucial for evaluation and also references. So in the future, like anyone can be able to reference to it. Then nursing diagnosis, we are moving to now nursing diagnosis. We are finished with the assessment. So second step in nursing process is the nursing diagnosis. Nursing diagnosis is a clinical judgment about a patient's problems or life processes. It provides the basis for selecting nursing interventions to achieve positive patient outcomes. So after collecting all the data that we have collected in the assessment, then we need to identify what exactly is wrong with the patient, and that is what is the nursing diagnosis in simple terms. Purpose of nursing diagnosis. The primary purpose of nursing diagnosis is to guide the planning and delivery of nursing care. Then also it helps nurses identify the patient's specific health issues and develop a care plan tailored to address those issues. So we identify the issue or the problem with the patient, then we come up with the solution that is directed towards solving that problem. Components of nursing diagnosis. These include the following. We have problem or diagnostic label. So this describes the patient's health issue. For instance, impaired gas exchange or acute pain. Then we have etiology or related factors. This identifies the underlying causes or contributing factors that lead to the health problem. For example, related to pneumonia. So we can say that impaired gas exchange related is the problem itself. Then the second component is the cause. Then the third component is the signs and symptoms or defining characteristics. So these are the objective and the subjective cues or evidence that support the diagnosis. They help confirm the presence of the health problem. For example, as evidenced by decreased oxygen saturation. So we can say that impaired gas exchange related to pneumonia as evidenced by decreased oxygen saturation. So you have tested the saturation of oxygen in the patient's body and it is low. So you come up with such diagnosis. So those are the three components of nursing diagnosis. Types of nursing diagnosis. We have actual nursing diagnosis. These are based on current health problems that the patient is experiencing. For example, acute pain related to surgical incision. So this actual nursing diagnosis actually is the type of nursing diagnosis that is made when the problem has already occurred. The patient is undergoing it. The patient has been done the surgery and is indeed in pain. Then we have the second type is risk or potential nursing diagnosis, and these are used when a patient is at risk of developing a health problem but has not yet manifested signs or symptoms. For example, risk for falls related to impaired mobility. The patient is not able to move well, maybe because the patient is just from the surgery. So if he tries to move, likely the patient is going to fall. So that's why we say risk for falls. It is not that the patient has fallen, but there's a risk that likely the patient may fall. Then, health promotion nursing diagnosis. This focus on improving the patient's well-being and preventing future conditions. For example, readiness for enhanced nutrition related to dietary education. So this shows that the problem is not there, but we identify this, and its purpose is to make sure that the patient's health is improved, or it becomes better. So health promotion. Then care planning. Just a moment, Samuel, you first pause. Let me first do something. I'm coming back. Hello, Samuel. Hello. Amazigaide. Okay. Nayo makendezo. Sijenga kukendeze. Okay, let's continue. It is supposed to be done. So this kind of care is not only made by the medical personnel, but the patient should also be involved in it, to make sure that, because there are some parts that the patient is the one who is going to really act on. Then treatment planning. It involves treatment planning for short and long-term goals. Evidence-based practice guidelines inform the goals. So importance of care plans. Care plans are based on evidence-based practice, and it consists patient-specific goals for for positive outcomes. So the goals that are involved are actually patient-centered. So enhancing communication and the continuity of care and taking into account overall and the comorbid conditions. There are some conditions that will come in on top of what the patient is suffering from. Those are the ones that we refer to as comorbid conditions. So types of planning, nursing phases of planning, we have the initial, the ongoing, and the discharge planning. So the initial planning involves the plan that you make when the patient is admitted or at admission. Then we have the ongoing, is the continuous planning that you make in the course of the care. Then the discharge is made when the patient is about to be discharged. Implementing nursing case of nursing process involves the following: carrying out nursing interventions from the plan and monitoring direct care, education and referrals and more. So you may continue monitoring, you may direct the care, you may complicated, then you can refer the patient. Referral is also part of the care that you can give to a patient. Using nursing interventions, classification, taxonomy. So when implementing the nursing care plans, we use the NIC taxonomy. So the NIC taxonomy is a standardized system that is used by nurses and other healthcare professionals to document and communicate the interventions they perform as part of the patient by senior nurses to make sure that the care that is given to a patient, to our patients, is harmonized and it is standardized. It is so we follow a certain criteria to make sure that we give care to the patient to avoid mistakes that may lead to death. So the purpose of NIC is as follows. The primary purpose of NIC is to provide a comprehensive framework for classifying nursing interventions. It helps nurses and healthcare providers identify and document the actions and activities they undertake to support patient health and well-being. So the taxonomy structure, the NIC taxonomy is organized into three hierarchical levels. Level 1 consists of 7 domains, and these include the following: psychological and no physiological. We have the basic, physiological, and the complex behavior. Then we have safety, family, health system, and the community. So the second level involves each domain, but it is further classified into different classes. So these classes offer a more specific description of intervention within the domain. Then in the third level, the classes that were got from level 1 then divided in level 2 are broken down into individual nursing interventions, providing detailed descriptions of specific actions that nurses may perform. So this is where now the interventions come in from. So as we continue, so NIC provides standardized level and the definition for nursing interventions, providing consistency and clarity in healthcare documentation. So this enhances communication among healthcare professionals and this supports research and evidence-based practice. NIC interventions are commonly used in electronic health records, like records that where people use computers and many other gadgets, and the other healthcare documentation systems. So nurses can select appropriate interventions from the NIC taxonomy when documenting care provided to the patient, and it makes it really simpler than if the patient was to come up with the words that she is, the nurse was to come up with the words that she is supposed to write for that specific care being given. So behavior nursing interventions. We are now looking at the different interventions. So these ones focus on modifying patient behavior. Examples of behavior interventions include the following: encouraging stress and relaxation techniques. So encouraging the patient to relax and forget about his or her stress is one of the behavior nursing interventions. Then supporting smoking cessation, telling the patient to stop smoking, then also engaging in physical activities for anxiety reduction. Those are simple and I believe you can easily understand them. Community nursing interventions address community-wide health behavior change, and examples of these community nursing interventions include the following: first-time mothers education program. So you may come up with a nurse may come up with education program for first-time mothers, teaching them how to hold their babies, how to bathe them, how to breastfeed, and it involves all first-time mothers within that community. Then another intervention can be promoting healthy diet and physical activities, promoting diet that will not cause less harm to the body, and also encouraging people to do physical activities. Then HIV awareness and violence prevention programs. Then family nursing interventions. These influence patient's entire family, and examples of this include family-centered approach to prevent illness spread, supporting breastfeeding, educating family members about patient care. So all this is under the family nursing intervention. So this involves the entire family to make sure that they give support to the specific patient or the client on those areas that we have mentioned. Then health system nursing interventions is ensure safe medical facility for patients and the staff. And examples of health system interventions include infection risk reduction for patients, patient environment safety and comfort, making sure that as the patient has come to the health facility to get medication, the patient should not go back with more complication, but rather should go back when he is healthy. Physiological nursing interventions. These address physical health needs, basic and complex interventions. So we have the basic interventions include feeding, hygiene assistance. Then the complex are the ones that you really need skills for, and these include the IV line insertion for fluids and many others. Maybe like a catheterization also, because it requires some skills to perform. Safety nursing interventions. These focus on patient safety and injury prevention. And examples of safety interventions include teaching uh, assistance calling methods. Like the nurse may be far away. What is the patient going to use to inform the nurse um, about her state, or informing the patient, the nurse, that she needs her by her side. So in some hospitals, um, they can use alarms, but in others, they can use maybe phone calls or things like that. So those are some of the ways that can be taught to the patient. So let's continue. So we are still continuing with nursing interventions. So the nursing interventions can be dependent interventions or collaborative interventions. So the dependent interventions are interventions that are ordered by healthcare providers. For instance, uh, uh, administration of oxygen can be ordered by the doctor, or dietary requirements, medications, and diagnostic testing. Then we have collaborative interventions. These involve input from entire healthcare team, and they may include physical therapy, personal care, hospice care, and spiritual counseling. Often require consultations or referrals to specialists. And the examples include bathing and dressing assistance to a patient. So those are the collaborative. May not specifically be done by the nurse, but it can be done by help from other disciplines like we have care interventions. These involve personal contact with the patient, and this category includes reassessment. So continue evaluation to detect changes in the patient's condition. Then activities of daily living or ADLs, and these tasks like eating, dressing, bathing, toileting, and ambulating. Then physical care, both invasive procedures like IV or catheter and non-invasive procedures like medications, repositioning, all fall under the physical care. Then informal counseling, providing guidance and support for addressing personal conflicts or emotional issues. Then teaching, an ongoing process that often is conducted by the registered nurses. So that is almost a part of the nurses because they do it now and again. Then we have indirect care interventions, benefit the patient but do not involve direct contact. And these include communication, essential for patient care patient to the dietitian. Then research, gathering of new information and best practices to inform patient care. And this is now becoming part of the nursing because all nurses are supposed to be involved in research in order to improve their knowledge. Then advocacy, supporting and working on behalf of the patient. Then delegation, transferring responsibility for a task to another person based on assessment findings and care priorities. Skills for implementing nursing care. We have cognitive skills. This involves learning, understanding, and critical thinking. Then interpersonal skills. This involve effective communication. Then technical skills. This involves hands-on procedures for patient care. Process of implementing care. Reassuring the client's condition, determining needs for assistance, and implementing nursing intervention. So these are the process of implementing the patient. We keep on reassessing the patient. We keep on determining the needs of for assistance, then also implementing nursing interventions. Like for instance, we can reassess the patient and we realize that the patient needs to be bathed. So we bathe the patient. In nursing intervention categories, independent, dependent, and interdependent. So the independent one, these ones are the ones that the nurse can think of and intervene on her own. Like for instance, you have checked the patient is unclean, so you decide to bathe the patient. That is independent. Then the dependent, this requires guidance from the from other disciplines. Like for instance, from a physician can prescribe the drug, then you administer. That is dependent. Then interdependent interventions. This involve team collaboration, like I have talked about, involving the dietitian, involving a physiotherapist, all that fall under interdependent. And supervising delegated care, delegating tasks to nursing team members, then accountability for outcomes. So you as maybe if you're a senior, get some work to a specific nurse who is junior to you, but you will be accountable for that work that has been done. If the work that you have delegated is passing of the cannula, then evaluation of care, collecting data for comparison, comparing data with the desired outcomes, and analyzing client response, identifying contributing factors, continuing modifying or terminating care plan. So that is what the evaluation is all about. We collect the data, then we compare. When the patient came in, we checked the patient. This is what we found out. We decided to do ABCD. Now we check the patient again. If the patient came in with high blood pressure, we came up with a strategy of care. We have cared for this patient. Then now when we check, is the blood pressure low or high? Then we compare and understand and get to see the effectiveness of what we have provided. So then we analyze the response and identify contributing factors. What are those factors? If the outcome is negative, the blood pressure did not lower, what are those contributing factors? Could it be that the patient is stressed? Because if the patient is highly stressed and we have been pumping the patient with medicine without considering the psychological part of it, then we have failed on one way or the other. So we need to involve the other technique to make sure that we lower the blood pressure. So from there, we can now decide whether we need to continue caring for the patient. If the patient blood pressure reduced but not so effective, you're going to continue because you have hope that the patient is going to become better. If you see that it has not really lowered, then you may need to modify. Like I've told you that you may identify that the patient has stress, so you start counseling the patient, teaching the patient a relaxation techniques. Or if the patient has now become okay, blood pressure is okay, the patient is talking well, is eating well, everything is fine, then you can terminate the care plan. So that is what evaluation is all about. Then the steps in evaluation, collecting data, I think this one I've talked about it. I've explained this, you'll be able to understand. Then discharge planning, transitioning patients to next level of care. Then key elements of ideal discharge planning include the following. We have include the patient and the family in your plan. Discuss the key areas that you really want to emphasize on. If, for instance, if a patient is having stroke, the patient is going to be discharged home, but this patient needs to be changed. The position needs to be turned every now and then. This you have to focus on it because it is the point of focus. Then educate in plain language. Educate these caregivers in a language that they can easily understand. Avoid the use of medical jargons because this will make them not to understand what you are talking about. Then assess communication effectiveness on a patient and the family goals. Components of discharge plan, it is composed of the following. We have equipment needed at home. Like for instance, if you're discharging someone who is bedridden, you will need equipment like bed or an area that is specifically designed for the care of the patient, because it's going to be a nursing home. So everything has to be prepared. You need to have that bed, you need to have a bedpan and the other things at hand. Then dietary needs or special diet if needed, medications for home, resources and emergency response, home care activities, summary of conditions, and make sure that you follow up. So conclusion, effective nursing process. So in conclusion, we have talked about comprehensive physical examination and observation, validation for accurate assessment, documentation for continuity of care, and diagnosis and personalized care planning, implementing interventions for positive outcome. So that has been that for today. Thank you for being part of this learning. God bless you. Samuel.